If you own or operate a home health agency in Indiana, not a home care or personal services agency, but a licensed home health agency provider type 5, this video is specifically for you. On May 13th of 2026, CMS froze Medicare enrollment for home health agencies nationwide, and it landed right on top of an Indiana state requirement that was already in motion. Most agencies know the basics, but there are 5 things about this moratorium that almost nobody is talking about, and some of them could seriously affect how you run your agency right now. A quick background before we get into it, because this might not make sense without it. Back in June of 2025, Indiana published a bulletin stating that starting July 1st of 2026, every home health agency enrolled with Indiana, provider type 5, both new and existing, must also be enrolled in Medicare. Then, in March of 2026, a new bulletin clarified that if you submitted your CMS 855A or started accreditation with an approved organization before April 1st of 2026, you could keep billing Indiana Medicaid while your enrollment was pending, with a final completion deadline of June 30th of 2027. If you didn't act before April 1st, you were already heading towards a compliance problem before the moratorium even existed, according to Indiana Medicaid. Then, on May 13th, CMS froze everything. But what does that actually mean beyond new enrollments are paused? Let's start with why this happened. CMS made this a nationwide freeze, not targeted at Indiana or even just the Midwest. And the reason is data that they were seeing elsewhere. In Los Angeles County alone, new home health agency enrollments jumped over 40% between 2019 and 2023. CMS found clusters of multiple agencies operating out of single addresses in Ohio. That's right next door to Indiana. They had criminal convictions for billing schemes where agencies charged Medicare for services that were never delivered to patients who were never actually homebound. CMS's existing tools like enhanced screening and post-payment review all operate after an agency is already enrolled and already billing. They wanted to stop fraud before it got the chance to get started, so they stopped letting agencies enroll completely. What that means for you as a legitimate Indiana agency is that you're affected by enforcement action being driven by fraud that's primarily happening in other states. That's not fair, but it is the reality of the situation. All right, thing number 2. Most of the conversation around the moratorium focuses on new agencies that can't enroll. But if you're already Medicare enrolled and running a legitimate agency, this could affect your growth plans too. Any new branch location or new practice location requires initial Medicare enrollment. That's blocked right now. If you've been expanding through a de novo strategy like opening new locations, getting them certified, building out your footprint, all of that is paused for at least 6 months. If you're in acquisition mode, there's an additional layer. Under Medicare's 36-month rule, a change in majority ownership within 36 months of a provider's initial enrollment can trigger a requirement to re-enroll as a new provider. That re-enrollment is also currently blocked by the moratorium. So what might look like a clean acquisition could actually get hit by a legal wall mid-transaction. Get legal eyes on any deal's ownership and enrollment history before you sign anything. Number 3, and this one surprises a lot of people. A lot of agencies are in a wait it out mindset right now, and that might be necessary, but here's what the waiting actually costs. Under federal regulation, specifically 42 CFR section 424.518, when this moratorium is lifted, any provider that applies for Medicare enrollment within 6 months of that date will automatically be assigned to the high categorical risk screening level. That means additional enrollment requirements, longer review timelines, and heightened scrutiny. Not because you did anything wrong, just because you're applying in the window right after a fraud freeze. So the longer the moratorium runs, the larger that backlog of agencies waiting to enroll becomes, and every one of them faces an uphill re-entry process. Plan for that, not for a smooth, potentially November restart. Which brings us to thing number 4. The moratorium is set for an initial 6-month period from May 13th. CMS can extend it in additional 6-month increments with no hard limit on how many times they can do that. For context, CMS's last home health enrollment moratorium started in 2013, initially in just a few counties from Florida and Illinois. It was extended repeatedly and didn't expire until January of 2019. That's 5.5 years. Industry analysts are already calling an extension to this moratorium somewhat likely. CMS gave no specific benchmarks or goalposts for what would need to change before they lift it. So don't build your 2027 business plan around a November lift date. Build it around the possibility that this runs a little longer. And finally, thing number 5. The July 1st Medicare enrollment mandate is specifically for provider type 5 home health agencies. If you're a PSA, attendant care, or waiver provider, that requirement does not apply to you. And this video isn't really about you. But here is what you should know. CMS's moratorium FAQ included language encouraging each state to decide whether or not to implement a comparable moratorium for their Medicaid and CHIP home-based care programs. And several other states are already doing that. They haven't required it, but they are actively inviting it. It's worth noting that CMS's 2013 Medicare moratorium did extend to Medicaid in the affected states. Indiana has not currently issued any bulletin indicating it plans to extend a moratorium to waiver or personal care providers, but CMS has essentially handed every state a roadmap to do exactly that. If you're a waiver or PSA provider, be sure to subscribe to IHCP provider notifications at in.gov/Medicaid/providers. In this environment, finding out about a policy even a week after it drops is too late. Before we wrap up, here is the key takeaways. If you submitted your CMS 855A or started accreditation before April 1st of 2026, you're protected under Indiana's grace period, and your application is exempt from the moratorium. Be sure you save that documentation. Any confirmation emails, screenshots, timestamps, certified mail receipts, all of it. Keep it somewhere you can find it if your status is ever questioned. If you're already enrolled and your status is solid, just think about what's going on right now. The same enforcement posture that is produced in this moratorium means more audits, more claim review, and more scrutiny of your documentation. Review your billing records, your plans of care, and your third-party contractor relationships, and get ahead of all of it. For situation-specific questions, you can call IHCP Customer Assistance at 800-457-4584. And for anything involving legal transactions or any other sort of legal exposure, getting a healthcare attorney involved before you moved is crucial right now. The moratorium hit Indiana home health agencies at a complicated moment, right on top of a state requirement that was already creating pressure. The 5 things we covered today are the parts of this story that aren't getting enough attention, and knowing them changes how you should be thinking about your agency's next 6 to 12 months. If this was useful, share it with another provider type 5 owner in Indiana who needs to hear it. And if you want to walk through your specific situation, especially concerning billing right now, that's what we do here at GEO. Thank you so much for watching. We hope this was helpful, and don't forget to like and subscribe.